When was the last time you thought about your cervix? If your answer is not often or never, you're not alone. But your cervix plays a huge role in your overall health. And today, we're going to break it all down. We'll talk about pap smears, HPV, what the tests are for, when to get them, and how to protect yourself long-term. Hi, and welcome back to Clarivive MedInsight, to learn differently, where we make women's health clear and easy to understand. Let's start with the basics. What is the cervix? The cervix is the lower part of the uterus that connects to the vagina. Think of it as a gateway between your womb and the outside world. It produces mucus, helps during childbirth, and plays a key role in fertility and menstrual flow. But just like any other part of your body, the cervix can develop problems, especially if it's exposed to certain viruses or conditions. That brings us to one of the most common risks, HPV. HPV stands for human papillomavirus, and it's one of the most common sexually transmitted infections worldwide. In fact, around 80% of sexually active people will get HPV at some point in their lives. Now here's the important part. Most HPV infections go away on their own by body's own immune system, but some types, especially types 16 and 18, can cause cervical cancer if left untreated. That's why screening is so important. A pap smear, or pap test, is a simple and quick test done in your doctor's office. During the test, a small sample of cells is collected from your cervix. These cells are examined for abnormal changes that might lead to cervical cancer. It's not painful, but it might feel a little uncomfortable, like a quick pressure or mild pinch. The good news? It takes only a few minutes, and it could save your life. When and how often should you get tested? Here's what most guidelines recommend. Start pap smears at age 21, from 21 to 29. Pap test every 3 years, from 30 to 65. Pap test plus HPV test every 5 years, or pap alone every 3 years. Over 65, you may not need further screening if your past tests were normal. Of course, your doctor may adjust the schedule depending on your individual history. HPV vaccine, who should get it? The HPV vaccine is one of the most powerful tools we have to prevent cervical cancer. It protects against the high-risk types of HPV that cause most cervical cancers. The vaccine is recommended for girls and boys starting as early as age 9, most effective when given before becoming sexually active, also approved for women and men up to age 45. Even if you've already had HPV, the vaccine can still protect you from other strains. Other ways to protect your cervical health. Along with regular screenings and the HPV vaccine, here's what else you can do. Use condoms. They reduce the risk of HPV transmission. Don't smoke. Smoking increases cervical cancer risk. Get routine checkups with your gynecologist. Learn to recognize unusual symptoms. Bleeding between periods, pain during sex, or unusual discharge. Remember, early detection equals better outcomes. Let's wrap up. Cervical health doesn't need to be scary, just understood. Regular screening, prevention, and awareness are your best tools. So take that pap test. Ask about the vaccine. Be proactive. Your body will thank you. Tomorrow's video is all about the most common birth control myths and uncover what's fact, what's fiction, and what you really need to know. Until then, subscribe to Clarivive MedInsight, give this video a like, and share it with someone you care about. Let's normalize the conversation about cervical health together. Thanks for watching.